Now the history, how developmental history. So first of all, hello, good morning. This is Dr. Ruxana, one of child doctor here. Am I speaking to Mrs. Sushan, mom of George? Thank you for coming. So today I made this arrangement to discuss about George health issue. So can you tell me what is your main concern? When you notice it, does it change over the period of time? Okay, so does any event occur before it? Did he lost any of his skill? What do you do so far for this condition? So do you think that he has any unusual features? And do you have any concern regarding his hearing and vision? How many language do you use at home? And do you have any concern regarding his behavior? And does he has this is about the presenting illness, and then just some sorts of the past illness. Does he has any long extending illness other than it? Then if yes, so we will go for the Sita pneumonic. This is the what was the symptoms that time. Can you remember what investigation done that time, and what was the treatment, and did he need any kind of hospitalization? This is the past illness we ask. And this few systemic review. If you get the answer of the delay, cause of the delay the previously, that's great. Otherwise we can ask in the CNS as a systemic review, we can ask that did he has any bug infection, do you have any concern regarding his head size, any surgery on the head, any trauma, especially the head on the back, and did he has any skin pigmentation, and do you feel that he had any neck swelling? And then we will ask about the developmental history. Here we can give a sound pose. So now I am going to ask you what can he do. So can he walk? If yes, so can he run? And if he can run, so we can ask that I want to know how he used the stair. We can get lots of information from it. And after that, do you have any concern that how he uses his hands for doing things? So can he draw? What can he draw? So if he draw the circle, so can he draw the square? So we get lots of information, and it's better to ask two questions. So and can he make tower? How many cubes he need to make a tower? Okay. And then if the station regarding the speech hearing, so no need to ask, we will assess this on the child. But if it is not the hearing and speech, so do you have any concern how he speaks or how he responds when you talk to him? So can he what can he say? Suppose he can say his name. Can he sing a song? This is the one question from the expressive, and one question from the receptive, maybe the how many body parts he can recognize, or how many commands can he follow. And after this there is social. So do you have any concern how what he do for his living? So how can he feed? Or we can ask about the toileting, or we can ask about how he play. It's better to ask about the play if the child is older enough, so we can go and get a more information regarding the developmental age at the social domain. Okay, after the social domain, there is we will take the perinatal history. First of the natal history. So I want to know let's go to the event when Ali was in your George in your tummy. Do you have any concern? It may be the personal question, but it's a routine question. Do you take any kind of recreational drugs, any alcohol that times? And then now I want to know about the birth event. Do you have any concern that So at the what age he was born, what was the gestational age, did he cry after birth, and if anything positive he will tell the detailed history. And after that I want to ask about the event after birth, any hospitalization needed, if yes, so can you remember at the what level of the hospitalization, how many days, what support he was received that time, did he undergo the screening test, okay, and then did he receive all of his jabs, and do you have any concern regarding his growth, and did he has any allergy to any food or medication, and then will you please describe your family, are you and your partner blood related, is there similar condition running in the family, and the social history, what do you do for your living, is it satisfactory, do you need any help, and will you please tell me about his schooling, do you feel any kind of bullying, any educational health care plan is needed, is maintaining or not, and then what's about your home environment, and then what is your biggest worry, and what how its impact in your life and on his life, and do you want to add anything in our discussion, what is your expectation from us, and thank you for being here. Now at the presentation, and we have to do this presentation within 1 minute, so we can say that from today I I receive Mrs. Sushan with 7 years old George, this is the name and age of the child, and now the main concern, her main concern, she had concern regarding the hearing and the speech of John, this is the main concern, and then now the positive findings from this history. Probably he had a history of meningitis, for which he was admitted for in summarization after the background history, the positive history. So positive history, maybe the child has diagnosed with meningitis, treated in the hospital for 7 days, and here he was given the antibiotic ceftriaxone amikacin, and there was a concern from the school as he is not following the school, and parents has the biggest issue about his school performance, and other so it is the positive history, and in the positive history we want to say what may be the cause behind it, and then school bullying we can say at the later. After the positive history, first the background, positive history, and then the tell about the developmental domain. Other developmental domain except the speech is age appropriate, and parents is very much worried regarding the school issue. This is how we can present the history. And for the presentation of the developmental station, after whenever we finish doing the developmental assessment, we can say that today I get chance to play with George, 7 years old, who is dysmorphic, playful, and good interaction throughout the examination, and today he demonstrated this in the receptive language, this, not able to demonstrate this, and in the area of the expressive language he did this. Today he demonstrated this, not able to demonstrate this. So considering this, this is a case of isolated speech and the language delay. However, in the speech there is no echolalia or no dysarthria is present. And this is how just we will do what is the important during the developmental presentation. This is today I get the chance to play with. There is no dysmorphic face. He appears to be well grown, however I want to do the anthropometry, and throughout the examination he has good eye contact and cooperative if it's positive. And during the area of the speech and the hearing assessment, in the expressive this, in the receptive this he able to demonstrate today. Okay, so considering this, this is how we can easily present a case, a speech, any case of the developmental station after doing the assessment. Thank you.